Hey guys, as you can see, I am still not at school today. I'm still in court, but that does not mean that you cannot learn while I'm not there. I will post this on Classroom Google, as you probably already know, and I will also post it in YouTube. So, right now, I'm going to start where it says proper posture. So the majority of this presentation, you will not see my face, but you will hear my voice. And I will go over the PowerPoints and lecture, and I expect you to take notes as I'm going over this as if I were in class. Yes, I will check your notes. All right, here we go. Proper posture is the position of body parts in relation to each other. Body mechanics is using all body parts efficiently and in a careful way. Both of these definitions, you should write TQ by them or a star because you will see these two definitions again. Both are necessary to limit stress and strain on the musculoskeletal system. I think that we talked about this already in class. What are the three actions that can increase stress on the body? And that's lifting, pushing, and pulling. Lifting techniques. Use the larger and stronger muscles, such as your thighs, your buttocks, gluteus, to perform work. Your feet should be shoulder width apart. This provides a base of support. Hold objects close to your torso. With heavy items, when trying to move a heavy object, what mechanism should be used to keep you safe? Now, because I'm not in class, we can't really have this discussion out loud for me to hear you. But what I would like for you to do is go to Padlet, which I put on host on your classroom, for you to answer this discussion question. Heavy items. You want to push or pull instead of trying to lift that item. Maintain a wide base of support. Ask for help if the object or the item is too heavy. Remember, we talked about twisting. This is how people get hurt. Avoid twisting the body. Turn your whole body in the direction in which you are working. And lastly, bend your knees and keep your back straight. Use your leg muscles for lifting. I can't stress how important it is to bend your knees. Several of you work in industries that require a lot of lifting, pushing, and pulling, and it may not even be on a patient. And you've already experienced hurting your back because you're not lifting properly. Bend your knees, keep your back straight, and use your leg muscles to bring the item up. Remember to keep objects close to your body or torso. Avoid unnecessary bending and reaching. Raise the bed or overbed table to your waist level or working height. We talked about that in safety. Don't get confused about the patient's level and your working level. When you're working with the patient, it's at your level, at your comfort. When the patient is left alone in their bed, the bed needs to be to the lowest level in order for them to get out safely and not fall to hurt themselves. When do we use body mechanics? Again, this is a question I'd like you to answer in Padlet. Ergonomics. Ergonomics is the science of work. Many corporations have departments that focus on ergonomics. My dad worked for ExxonMobil. He has carpal tunnel. Because a regular mouse gave him so much trouble, his ergonomics department was able to find a joystick mouse that took the pressure off of his wrist and allowed him to stay at work and be productive. I had a patient that had low back issues. He was not able to sit down for extreme amounts of time. So his job's ergonomic department invested in a hydraulic desk for him to raise his desk so he could stand and work instead of sitting. The best examples I can give you of ergonomics, again, is the science of work, but it's how to make it efficient. The science of work to the user instead of forcing the user to fit the work. That's exactly what an ergonomics department does. They find something that's going to make the person be able to be successful in their day-to-day activities with slight modifications. OSHA, I hope you all remember what that stands for, advocates for a no lifting policy in long care facilities. That would be nursing homes, hospice care. That's why they use lifts. Because they don't want patients to fall because a nurse or a doctor, someone tried to lift a patient and end up hurting themselves. Range of motion. Range of motion is the complete extent of movement which a joint is capable of. It is primarily used when doing routine activities such as ADLs. ADLs stands for activities of daily living. So combing your hair, brushing your teeth, getting dressed A lot of you are thinking, well, Miss, we do that all the time. But there are a lot of people that can't. So be careful what you take for granted. Again, ADLs is activities of daily living. And yes, you will see that again. Excuse me. The purpose of range of motion: to prevent problems caused by a lack of motion or inactivity. With inactivity or a lack of motion come contractures. Contractures are the tightening and shortening of a muscle. An example is foot drop. Hopefully my video works. Let's see here.
After the surgery, I could not take the grin off my face, and I think I smiled.
So this is a foot drop
Foot
injury.
drop, peroneal nerve injury. What is a foot drop? The patient cannot raise the front part of the foot because of weakness or paralysis of the tibialis anterior muscle that lifts the foot up. So when the patient is walking, he will have a steppage gait. A steppage gait means the patient slaps his foot down on the floor because the foot drops, and his gait will show that he's raising the thigh up in an exaggerated fashion. The foot drop usually results from an injury to the peroneal nerve, which is susceptible to injury at any point of its course. The peroneal nerve comes from the lumbosacral plexus.
Okay, he going into too much. I don't need to know that. You just need to see foot drop. That's it. Muscles may atrophy when they are not in use. And atrophy means to shrink. And how do you spell that? It's A-T-R-O-P-H-Y. Atrophy. Muscles may atrophy or shrink, but the word I'm looking for is atrophy when they are not in use. If you've known anyone, or if yourself, you've broken a bone and you've been in a cast, what happens is that muscle or those muscles have not been used in quite some time because the bone is trying to heal. Well, the muscles around that bone weaken and it atrophies. So when a person takes off their cast, they may have one extremity smaller than the other because the muscle has shrank or atrophied while not in use. Joints will become stiff. If you've ever heard your parents say, if you don't use it, you'll lose it, the same thing happens. If you're not exercising and stretching, you become stiff. You can't move. And last is blood clots and decubitus may occur. We've talked about bed sores and decubitus, and when a patient is not moved, they're left in a bed constantly, these things happen. I've already showed you some gory and gruesome pictures of decubitus, so I won't do that to you today. You do not have to write this slide because they're on the next three individually. But the types of range of motion are active, passive, and active assisted. Active range of motion, and ROM, is range of motion. That is the abbreviation. So please make sure that if you see that on your exam, that you know what it means. Active range of motion are movements performed by the patient without help. Active range of motion is movements performed by the patient without help. I'm going to try to show you this other YouTube video on active range of motion. I think I have it stopped where I want it, so you can see what active range of motion is.
And then you look at to see if it's equal. If you don't notice the movement.
Okay, so that's fine. Wants to act funny. It's okay. It is. Let me go to this other one that I don't want to use because it's really long and drawn out. Let's do a shoulder.
I was very active and I was laying on the couch for months in pain. And
This is going to be a video on active range of motion assessment of the shoulder complex. To allow for movement.
Move through, here we go. So he's moving his shoulders on his own. That is active range of motion. No one is helping him. No one is assisting him.
Ask your patient to perform the same movement, but now you're looking at him from the back.
And this is how someone would perform range of motion.
To evaluate.
Because there is a difference. Passive range of motion is a movement or an exercise cannot be performed by the patient, and the healthcare worker moves each joint through its range of motion. This individual may have had a stroke and they can't move one side of their body. Let's just say their right side was affected. Well, all exercises on the right side will have to be passive. Someone will have to help them get through the exercises. Because they're unfortunately unable to do it on their own. And last is active assistive range of motion. The patient does the exercise with some assistance from another person, preferably a healthcare provider, someone who has been trained in these types of exercises or rehabilitation methods. And I'll show you two videos I paused, so of course I hope you realize I'm giving you time to write these down. Alright, let me go back to YouTube really quick. We're going to go here to the passive range of motion.
Range of motion is a basic technique used for examination of movement and for initiating movement into a program of therapeutic intervention. There are 4 types of range of motion. Passive range of motion is movement within the unrestricted range of motion for a segment that is produced entirely by an external force. There is little to no voluntary muscle contraction. Active assistive range of motion is a type of active range of motion in which assistance is provided by an outside force because the prime mover muscles need assistance to complete the motion. Active range of motion is movement within the unrestricted range of motion for a segment that is produced by an active contraction of the muscles crossing that joint. Self-assisted range of motion, the patient is taught to use the stronger extremity to move the involved extremity through range.
You will not be responsible to know self-assisted range of motion.
Of motion. So I'm going to reposition the pillow to get it out of the way. And for your hand positioning, you're going to want one hand on the wrist and one supporting the elbow so they're crossed. With that crossing, you'll see that your motion moves quite fluidly. And also you want your legs spread out just a little bit so that you can move with the motion. And right now we're doing shoulder flexion and extension. And the next movement is shoulder abduction and adduction. So we're abducting and adducting. Abduction, adduction.
As you can see, this individual has no strength whatsoever, and the healthcare provider is having to do these motions for her. And this is active assisted.
Hi, my name is Jamie. I'm a student physical therapist assistant, and I will be doing an active assisted range of motion skill check today. Hi, Nicole. I'm Jamie. I'm a student physical therapist assistant. Nice to meet you. What we're going to be doing today is we're going to do some active assisted range of motion. So you have some range of motion, and you're just having some trouble getting those end ranges when you're doing that range of motion. We're going to start with shoulder flexion today. So what I'm going to do is I'm going to have you laying down on the mat. And I'm going to passively take you through the range of motion so I can see what your range of motion is. Okay, and I was leading with that thumb, right? Perfect. Good. Now what I want you to do is I want you to do most of the work this time. I'm leading with that thumb. When we get to that thin range, I'll bring you a little bit further. There we go. Perfect.
This is active assisted range of motion, in which the patient has some range of motion but in order to go the full range of motion, assistance is needed.
Just about 8 to 10 times. For the sake of the video today, we're only going to do a couple of them. Perfect. So this is shoulder flexion and extension. One more. And return. Perfect. Very good. Okay, Nicole, the next thing that we're going to do is
Okay. So this is the end of body mechanics. I will post the next PowerPoint on range of motion. I might use my husband as a demonstrator. I'm not sure yet. But I hope to see you guys Thursday. I really don't want these people to keep me any longer. It's really boring just sitting in a room waiting to go into court. So I miss you guys. I will see you Thursday. Pray for Thursday. And you guys be good.